Okay. All right, so good morning, welcome, thanks for coming. I'm excited to be here and talking about gut health and in specific food sensitivities. So I'm curious to start, how many people here have an interest in autism in specific? Okay, good. I added a lot of autism-specific pieces to the presentation, so hopefully you'll find that valuable. And then also, this is only about 45 minutes long, so we'll have 15 extra minutes for questions. And I want this to be as helpful to you guys as possible, so if you think of something as we're going through the presentation, just ask at that time and we'll talk about it then. Okay. So this is nutrition information, not medical advice for anything specific. Check with your primary healthcare provider. And no conflicts of interest. So today we're going to talk about, why pay attention? Why should we pay attention to food sensitivities? Why should we pay attention to gut health? We'll talk about some of the research around it and what we know. And then we'll talk about the differences between food allergies, intolerances, and sensitivities. There's a lot of confusion there, so hopefully afterwards you'll feel a little bit more confident in knowing those differences. We'll talk about some possible causes to food sensitivities, some speculation out in the medical community. We'll talk about lab testing, the differences between the different types of lab testing, which I find are often confusing for people. So again, hopefully that'll kind of clarify some information for you guys. And then we'll talk about starting a food elimination. So if you don't want to go the testing route, you kind of want to just do a food elimination to start at home, I'll help to guide you and give you some information about that. So to start here with food sensitivities, this is just a list of different, can you guys see okay? Okay, of different disease states that can have a primary or second role related to food sensitivities. So some of these are obvious to people, like the gastrointestinal ones, irritable bowel syndrome. We can, a lot of people already know that usually there's food sensitivities or food issues playing a role there, but some of the ones that people aren't as aware of are things like migraine or depression, or down on the bottom left you can see fibromyalgia and arthritis, and then autism as well, type 2 diabetes. So just knowing that if you know somebody that has anything in these lists, that maybe they could consider looking into what we're going to learn about today with food sensitivities as a part of their journey to feeling better. So autism and digestion. How many of you guys already know that about 50% of children with autism have at least one gut symptom? Did you guys know that already? Probably. So the severity, which this is really interesting, but the severity of GI gastrointestinal symptoms significantly correlated with severity of autism symptoms. So meaning, if we can get people who have the autism, if we can get their guts feeling better, then, what could that do to their other symptoms that they might be struggling with? Hopefully we'll see improvement there as well. The research also showed that kids who have autism have more intestinal permeability as well. So our gut lining, it's supposed to be semi-permeable. Things are supposed to kind of move in and out, but it shouldn't be too permeable. So if it gets to be too permeable, if between the cells those spaces get to be too wide, a basic way to think of it, then that's where we can start to get some of these autoimmune symptoms and issues. So too much intestinal permeability could be an issue. And then also the research showed that with kids with autism, we found that they have less diversity of bacteria in their gut. So we have this whole microbiome in our intestines, and we have actually 10 times as many bacteria in our body as human cells, which is pretty wild to think about. So we're just kind of starting to understand how these bacteria all play a role. So for example, most of us have E. coli in our system. E. coli, not good, but it doesn't cause most of its issues because we have enough of the good bugs and a good microbiome to kind of outcompete that. So if you have less diversity, it's thought that that could be contributing to some symptoms and issues as well. So we'll kind of talk through some specific research that has been done with food and autism, and this is one that was just published last year, 2018. Yeah, last year. The comprehensive nutritional and dietary intervention for autism. It was a randomized controlled 12-month trial, so a decent length in trial, and they showed that the positive results suggest that a comprehensive nutritional and dietary intervention is effective at improving nutritional status, nonverbal IQ, autism symptoms, and other symptoms in most individuals with autism. Parents reported that the vitamin mineral supplements, essential fatty acids, and healthy gluten-free, casein-free, soy-free diet were the most beneficial. So, there's something there, right? If we have these parents kind of reporting that changing food around is helping. This I wanted to add because we're going to be talking about some testing, and I just wanted to put up front to kind of spark your interest in this testimonial and how this mom found this mediator release food sensitivity testing, how it helped her son. And in medicine, I just want to kind of put the disclaimer, there's not one thing that works for everybody, but we kind of have to navigate our road to healing and try to find what's going to help us, and it might be multiple different things, but this mediator release testing I found for the right people can be an amazing tool in helping them feel better. So, this is long. On the recording, I'll send the PDFs too. You can read through it all yourself, but I just want to read the highlighted parts. This time last year, my son was considered delayed in many areas. He was 2 years old and not speaking, not making eye contact. He had many therapists and was making little, if any, progress. His developmental specialist said that she suspected autism. He was always sick, uncontrollable crying, not interactive. Dietary intervention seemed like a very safe and non-invasive way to help David, and that's kind of how I look at nutrition and some of these more functional integrative approaches too is, what's the potential benefit to the potential risk? Even if we don't have tons of research, because with nutrition, honestly, it's hard to research nutrition because there's a lot of different variables that play into it. But anyway, so they removed all wheat gluten products. David improved immensely. I was certain that his diet was crucial for his well-being, and then I hit a brick wall. David was avoiding all the foods that I thought were bothering him, but still having some bad nights and days. They found out about this LEAP, this mediator release testing, which we'll talk about later, and Mom was really excited because she knew that he was sensitive to foods, and she felt that this being able to test, and I'll explain how it works later, would help him. So he did this, and after going through the protocol, he started to sleep at night. His dark circles were replaced by bright eyes. He started making progress in his therapy sessions. His so-called stomach flu was cured. And for her and her son, it really gave them the tools to help personalize his diet. And so she has her name down here and contact information. She just says that if you ever have any parents of a child with autism, please tell them there's so much hope with dietary intervention. So you can contact her if you want to hear more about her experience going through MRT and LEAP. So, for the right person, it can make a huge difference. And here's just another one. I'll let you read that one on your own. And so a few more research studies we'll go through. This one's interesting because it showed that food allergies were 2.5 times more common in children with autism. So again, it goes back to the question of why is this? And we know there's this gut-brain connection, so what can we do with trying to dig into the digestive health, which, is my specialty, and how can that improve brain health? And I've had clients who, when we help their digestion, improve their digestion, they'll get rid of their anxiety that they've had for years, or their mood will significantly improve. So really kind of tuning into that. This is a summary of diet, nutritional, and medical therapies for autism, and it's based on 150 research studies. And I'll just kind of walk you through this chart, but it has on the left here the different types of food changes. And if you look at this report, it's a lot of different things. I just pulled together the food changes because that's what we're talking about today. So you can see, for example, this top one, the families removed sugar, and out of the reports that were kind of gathered together, over 4,000 reports, 2% got worse, 46% did not notice a difference, and then 52% got better. So then when we come down here to the gluten and casein-free diet or plan, you can notice that 69% reported improvement. So that's why, out of all these, that's the highest, and that tends to be the one that most people start with when they have a kiddo with autism. But it goes back to that whole weighing the potential risks to the potential benefits. Low potential risks, which with possible benefits. So, why not kind of look into this?
Can I ask what the FEMGO, just briefly, what the FEMGO or FEMGO diet is?
Yeah, it's basically removing food additives, like colorings and some of those, non-food food items. Yeah. And then gluten sensitivity and autism. So this is really interesting because it's showing that we have research showing there are several reports linking gluten sensitivity, so not allergy, but just the sensitivity with neuropsychiatric manifestations like autism, schizophrenia. Again, that whole gut-brain connection. Why is this gluten, for some people, triggering such severe brain symptoms? This one's showing how a personalized elimination diet may lead to relief of the autism symptoms and the occurrence of gut disorders. So hopefully that kind of helped spark the interest, and now we'll kind of talk through the differences between allergies, intolerances, and sensitivities. So let's do a little game. We'll guess if it's a food allergy or a sensitivity. So number one here, usually limited to the airways, skin, and the gut, the gastrointestinal tract. Do you think that's an allergy or a sensitivity?
Allergy.
Mm-hmm. Yep, exactly. Sensitivities, it can be anything. So if you remember that list of diagnoses, like the arthritis or brain fog or skin rashes, it can really present in different ways for people. Number two, symptoms start from 45 minutes up to 3 days. Mm-hmm. Yeah, allergy is usually more immediate. And so if you ever talk to somebody, I get people like this all the time. They're like, I do a food journal. I just really can't connect the dots between what foods are causing me issue. But I know, I really have a strong feeling that foods are causing me issue. And that's usually because we could eat a food today, and then 3 days later, we're going to have symptoms from that food. Not always. Sometimes it's more immediate for sensitivities, but that's why it can be hard to kind of tease things apart. So number three here, about 20 to 30% of the population is affected. Yep, exactly. Allergies is about 1 to 2 or 3%. And then number four, 1 molecule of food needed to trigger a reaction. Mm-hmm. Allergies. So sensitivities, it can be a small amount of food for people, but it can also be a large amount. Everybody is a little bit different there. Okay, so now we'll talk through each of them specifically. So food allergies, we get this more immediate immune reaction. And what happens is the body creates these IgE antibodies to the food, which cause these pro-inflammatory mediators. So that's something we'll come back to a little bit later and talk about, but from the mast cells, and that causes those symptoms like the anaphylaxis or hives. These are some of the common food allergens, but certainly people can have an allergy to foods that aren't on this list. What's interesting about food allergies is, you might know this already, but in Australia, the rates of food allergies has doubled over the past decade. So it kind of begs the question, why are we seeing such a higher prevalence of this? And in Melbourne, there's a really exciting study that they're in the process of doing where they started with a small study and they're expanding it now, but they took 52 kids who had an allergy, and they took that allergen and combined it with a probiotic, so just very small amounts, and they had the kids take that. After that, 80% of those kids were able to eat their food allergen. So the thought is that the immune system is recognizing that probiotic as good, and then hopefully recognizing the allergen, that antigen, as being good as well. And then they're able to tolerate it. So it's really exciting. The bigger study that they're doing, we won't have results for another 4 or 5 years, but promising. So food intolerances. The biggest thing to remember, I guess, between these three is that food allergies and food sensitivities involve the immune system. Food intolerances don't, so they do not involve the immune system. It's usually a lack of an enzyme or a nutrient needed to help break down that food. So, for example, how many of you know somebody who has lactose intolerance? Yep. So, lactose intolerance, and do you know that sometimes they could take a lactase enzyme and then tolerate the food? So they can kind of supplement with that enzyme, because if they don't, they don't have that enzyme or enough of it to properly break down that lactose. And what happens is they'll get some gut fermentation from it. They'll get some gas production that can cause some of these gut symptoms. So the bloating, gas, distension, discomfort, loose stools. Food intolerances, so somebody who has lactose intolerance versus someone who has a dairy sensitivity, they're different in that if somebody has lactose intolerance, they could tolerate a lower lactose dairy item. So you sometimes notice that they can tolerate like butter or cheese or something that has much less lactose. Whereas somebody who has a dairy sensitivity, oftentimes they have to cut out all dairy. They could maybe tolerate some butter or some cheese just because there's such a small amount of that casein, the dairy protein, that people usually have a sensitivity to in it. But usually they have to cut out the whole food category. So then sensitivities, this is kind of just a basic, route of how these can cause inflammation in the body and cause symptoms. So we have these triggering mechanisms. It could be any food for people. People even can get sensitivities to like curcumin, turmeric, which is thought to be really great, and it is. A lot of good research showing how it's anti-inflammatory, but for somebody who has a sensitivity to it, it could be causing more issue. So it could be anything, and then it can cause this cell activation. We'll talk a little bit more about this when we talk about the lab testing. Causes this mediator release, and the mediators cause the symptoms. And then this is just a chart kind of detailing out the different pathways. The biggest thing to remember, again, is just food allergies and food sensitivities are related to the immune system, and food intolerance are not related to the immune system. Any questions about this section before we move on to testing? Okay, so possible causes. Why an epidemic? What do you guys think? Any thoughts?
I think there's more chemicals in our food nowadays.
Yeah. Yeah. Yeah, that is a speculation. It's kind of like, what's that doing to the gut, and how is that affecting our gut in a way that's maybe causing us not to tolerate certain foods, or maybe it's, we'll talk about it right now, but so speculation, we have poor digestion or an unbalanced gut flora, low butyrate. There's some research on which butyrate is basically this short-chain fatty acid that our body produces when we eat certain types of fiber-resistant starch, and it's really good for the immune system, really good for healing your gut lining. So, for example, if you eat like a cold potato or a green banana or soluble fiber, the gut bacteria that can create this butyrate, they create it, and then that supports our gut lining health and then our immune system. So low butyrate has some research connected to it. But poor digestion, the thought is that intestinal permeability, again, if our guts are overly permeable, so we should have these, little spaces, but if it's too much, that could be causing these foods to kind of trigger our immune system to cause these more systemic issues. So sometimes it's a matter of if somebody's having a ton of food sensitivities, we want to look closer at the health of their gut in general and see what we can do to try to support that lining back to health, which we'll talk a little bit about later. This toxic-induced loss of oral tolerance, so exactly, the overexposure to chemicals, pollutants, chronic stress, severe trauma, the gut-brain connection, healing digestion to improve brain health. It goes that way, but it goes the other way too. If we're overly stressed, have been through a lot of trauma, that can in itself affect our gut. And I've had one client in my practice where we were making some food changes, nothing just seemed to be helping, and she went away with her family for a Thanksgiving vacation, and all of her gut symptoms went away after like 4 days of vacation. We're like, and I felt like I didn't help at all, but she was like so grateful that for the whole process and her kind of like figuring that out. So definitely a two-way street. Immune system overload, genetics, when doesn't genetics at least play a partial role, but there's this whole field of epigenetics and how our genes can change based upon the foods we have, the environment we're in. And then genetic engineering and food additives. And I just feel like we don't quite know yet. If you look at the research on GMOs, it's not very strong to, say they're really concerning, but it's also something that's very hard to study. So I think we're just kind of doing this big experiment on the human population right now. I personally don't feel like we know enough about it yet. But going back, what do I have next? So talking about wheat in particular is an interesting conversation. You might know somebody who says, I went to Europe and I tolerated wheat fine, but I can't tolerate wheat in our country. Or, I tolerate sourdough wheat, but I can't tolerate normal wheat. Or organic versus non-organic. Have you guys heard people say that? Have you had any experience with that yourself? Yet? Do you want to share? Or?
Well, I
It's greatly helped. Yeah. Do you find that you can tolerate like a sourdough wheat, or do you have to avoid them? Okay. Yeah. Sure. So one of the concerns with wheat harvesting in our country, and I don't know if you guys know this already, but conventional wheat is sprayed with Roundup before it's harvested to help dry it out. So Roundup has glyphosate in it. You might have heard about that. There's a researcher at MIT over on the East Coast, Dr. Seneff, Seneff, I believe. And she's doing a lot of research on it, and what we're learning is it can impact our gut health in negative ways. So why do they do that? Well, because it's drying out the wheat, and they don't have to let it sit in the field for days to dry out on its own. It's quicker, But the question of, how is that impacting our immune system when we eat wheat that's kind of treated with that versus, what we used to eat decades ago, which would have been not sprayed with things, kind of slow fermented to help break down the nutrients in it better and easier to absorb. So why gluten? Do some people say, everyone should avoid gluten? I get this question a lot, so I just kind of want to share the background to it and talk about it a little bit. So this study showed that gluten exposure induced an increase in intestinal permeability in all individuals, regardless of whether or not they have celiac disease. It's important to remember, I think, that this is one study, but this is why, if somebody comes in with autoimmune issues, it's a common food that we'll recommend doing as a part of that elimination. Cutting it out for a few weeks, adding it back, seeing if it makes a difference. And this is what a lot of people are referencing when they feel like everybody has to cut wheat out. And so, how might this impact brain health? Well, if we have some inflammation in our intestines, it can lead to some malabsorption. This is just one pathway, but it can lead to nutrient deficiencies, and that can impair neurotransmitter metabolism because we need different vitamins and minerals and things and amino acids to make our neurotransmitters in our brain function properly. And I love this chart because it just has the research showing how different nutrients can impact symptoms related to autism. So we'll go through a couple of them. This is just SpectraCell Laboratories, and at our clinic, Holland Biomedical Clinic, we can run full nutrient panels for people, and I actually recommend everybody get this done. I can't think of one person that I wouldn't want to check nutrient status on, because I just think it's really important for preventative health even. If somebody's healthy, preventing them from having issues. So SpectraCell, they have a panel that runs, I think it's 36 different nutrients in the cells. So they actually look at the cellular level, which is more accurate than just checking a blood level. So let's talk about a few of these. Zinc. So zinc can eliminate mercury from brain tissues. So the zinc-copper ratio is particularly low in kids with autism. Low zinc impairs the protein that removes heavy metals from the body. Magnesium is a cofactor for the neurotransmitters. Magnesium is really helpful for anxiety, and if you were listening to the last speaker, she talked about how anxiety tends to be the number one symptom for kids with autism, so that can be extremely helpful. But a cofactor for neurotransmitters that affect social reactions and emotions. Kids with autism have low levels, improves effectiveness of B6 therapy. We go down to B6, which is a cofactor for the neurotransmitters, serotonin and dopamine. And I don't know if you know this, but serotonin has a similar pathway for making melatonin, that like sleep neurotransmitter. So conversion of B6 to its active form is compromised in many people with autism. Supplementation trials with B6 resulted in better eye contact, speech, and fewer self-stimulatory behavior in kids with autism, or people with autism. Some consider B6 in combination with magnesium to be a breakthrough treatment for autism, or therapy, part of the plan. Has anybody had this nutrient testing done? Yeah? Did you notice that it was helpful for you?
Some of it, yeah. Starting with fulvic acid.
Oh, good. Okay. Okay. Trying to fine tune it. Yeah, and it's kind of like looking at everybody as an N of one study. We're all kind of our own case study because we can't just blanket, give recommendations. And that's where I really find some of this functional testing can be helpful to give us the right information instead of just, putting all these supplements that have been shown to help on somebody who might not actually have a deficiency. And the other thing about this is that if somebody has a deficiency, we have to use much higher doses of that nutrient to replace that deficiency. Most that we wouldn't just generally, I would never just generally give to somebody with a suspicion. I'd want the testing. And it can take, depending on the nutrient, it can take 3 to 6 months or more to replace that. So it might take a few months before you notice symptom changes even. But I was recently working with a woman who came in January with really severe anxiety, and we did this micronutrient testing. We did the MRT testing, which we'll talk about, the food sensitivity testing, and I just met with her this past week, and her anxiety, she marked a 0 on her symptom questionnaire, which is really exciting. So just kind of the power of using some of this stuff. So if you are familiar with the Institute for Functional Medicine, you might know this already. It's the 5R framework, and it's just this framework for helping to improve gut health. So there's a lot to it, kind of a lot of specifics under each of these categories, but this is just the big overview. We want to remove anything that's causing damage. So be it food sensitivities, be it, anything that's kind of coming in. Even, if somebody has mold in their house and they're reacting to that, you have to remove that, and then move on. Replace. So if someone has low stomach acid or isn't making the proper enzymes to break food down, or, bile acid factors, kind of X, Y, Z, we have to replace those to really, and nutrients, we have to replace that to really help the body heal itself. Reinoculate, and that's referring to, these are fermented pickles, referring to the microbiome and those good bacteria. So making sure we're trying to support that microbiome as much as possible. Repairing is also kind of using some of those nutrients that are needed, like the zinc to help repair. You might have heard of glutamine to help repair. And then rebalance, that's the stress reduction. Get out into nature, make sure that we're balancing that nervous system with our lifestyle. So we'll talk about lab testing because we're just going to focus on this food sensitivity and this remove piece today. So different lab testing. I'm going to kind of breeze through testing for intolerances and allergies, and we're going to focus more on the sensitivities today. So food intolerance testing, it's breath testing for lactose and fructose intolerance we can do. Some food intolerances, there isn't great testing for it. So if you've ever heard of FODMAPs, these fermentable carbohydrates that can cause people digestive issues, particularly for irritable bowel syndrome, gastroenterologists are starting to recommend it a lot more, following a low FODMAP plan for 2 weeks and adding back in. It's a little bit complicated, so it's helpful to work with a dietitian if you know somebody that suspects that might help them. But anyways, that's food intolerances, and you can't test for that, so you basically just have to do the elimination protocol to see if that helps you or not. And then if you have a lot of intolerances there, thinking what might be causing those intolerances. For allergies, we have a few options here. So the top, I'm not an allergist, so again, I'll just kind of give a brief overview, but with skin testing, you can see the picture here where they put the antigen in the skin, then you see how big that wheel gets. The wheel gets big, that's a bigger allergy to that antigen. What's interesting about it, what a lot of people don't know is, it's good for environmental allergies, not as good for food allergies though. There's only a 40% positive predictive value for it, so not terribly helpful, which is why usually doctors will run this IgE testing. So you can see, if you look at IgE versus IgG, can be confusing. So IgG is a food sensitivity thing that we'll talk about, but IgE, that's allergies. So it's different. This can't pick up food sensitivities. So it's any antigen with a protein base. It doesn't pick up chemical allergies, anything like that, and it's 60% accurate for food allergy, which I think it's a lot lower than most people think it is. So if something comes up on there that you're like, that's weird, I eat that and I don't seem to have an issue with it, just know that it's not perfect. No testing in medicine is perfect, 100% accurate, but that's, 60% isn't awesome. The oral challenge is actually the best thing to do, and that's basically you are on a elemental diet, elemental meaning food broken down to its smallest form. So it's like a powder of these amino acids, so protein broken down to amino acids, quickly absorbed carb. So just think of like a very broken down smoothie or something like that. So you drink that for 3 days, or you fast. So you have like a very bland diet of like rice and chicken or something. So then on day 2 or 3 of doing that, you're given that food that there's a suspicion of having an allergy to. It's not done, it's very accurate, but it's not done very often because it just takes a lot of time and you have to, set up that appointment, and you guys all know that it's hard to get into a doctor, even last minute. Or sometimes people have to be admitted just in case they do have a reaction to that food and have issues. So you want to be in a setting that is going to be able to handle that situation. So that's why, even though this is more accurate, the IgE testing is done the most often. It's just easier. And then food sensitivities, again, this is totally different. IgE is a different mechanism, but then sensitivities, we have all of these options. Does this confuse any of you guys?
Yes.
I know. Okay, we'll talk through it. If you think of questions, please ask while we're going through it. Have you guys seen IgG in the news lately? No? Okay. So IgG testing, this is the one that's most commonly done because it's cheap and easy, but it's the least, well, I won't say least helpful, but the Canadian, the American, the Australian, and the European societies for immunology all discourage using it because the research just isn't really there. And also, IgG, there's some research showing that having higher IgG to a food could be a sign that the immune system's starting to tolerate that food, so it could be a good thing. So if you've seen anybody get this IgG testing done, they cut out all their foods and are like, maybe I feel better, but not really. That's usually why. I want to draw your attention over to the right here and kind of talk through some of this. Even if you don't understand what all these big words mean, just kind of hang in there with me, because I'll do like a very high-level overview. We have these mechanisms that can trigger the cells to release the mediators that can cause symptoms. So I have all these words up here because I want to point out that IgG is this little one right there. That's the only thing that it's testing. But if IgG is way up here and symptoms are way down here, we're missing a lot. So then we move on and we have this ALCAT and this MRT testing. It was created by the same immunologist. This is an older one. This is newer, patented, so only one company can use it right now. And they're both similar but different technologies. This is just his newer technology that's more accurate. So they're both an indirect method of measuring mediator release. So going back over here, they're measuring this box, which is right before the symptoms. And that's why we can see people getting better improvement than with the IgG testing. So with ALCAT, the older one, it only had a 20 to 30% false positives, negatives, whereas MRT, mediator release testing, it has about 95% sensitivity, 92% specificity, and greater than 90% reliability. So, similar results when you retest, which is what you want. So just more accurate. And so with mediator release testing, we don't have huge studies on it. Really, there's not an awesome option for food sensitivity testing, but what mediator release testing does excel in is we have a lot of great testimonials from it, and that's kind of the first part of research. You use it, you get testimonials, and we don't have big research because it's a funding issue. So it's a small company, and hopefully we'll get more research, but that's why on the bottom here I have written, evidence-based practice uses the best available evidence, the results of peer-reviewed scientific studies whenever possible, and when the science is lacking, expert opinion and experience. So if you ever hear, mediator release testing being talked about in a negative light. It's usually just because we don't have big research on it, even though you can look up and see some really great testimonials. From my professional experience and opinion, I wouldn't use IgG. I feel like that's kind of a waste of money, but if you've tried a lot of things already, I think this mediator release testing can be a really great option for people and give relief. You know, I have a woman in my practice who is having severe pain for 12 years, 8 out of 10 pain, and after 6 days of doing this mediator release testing protocol, so, just only eating her lowest reactive foods, she now has some days of having 2 out of 10 pain, which is awesome, because then we can go from there. Some others, have you guys heard of applied kinesiology? It's the muscle testing where they put like a piece of food on your abdomen, they push it on your muscle. Some people say, yeah, that helped me, but the research isn't very promising on it. For those of you that don't know it, I should explain more. So it's basically they take a vial of a food, you're laying down, they put it on your abdomen. I think different people might do it differently, but this is one way to do it. You lift your arm up, and then a provider pushes your arm down. And the idea is working with the energy systems, and if that food is something that you don't tolerate, then your muscles are going to be weaker, and the provider is going to be able to push it down quicker or easier. Kind of subjective, right? Because, how can somebody really use the same pressure every time? But, when I look at the research, I try to be fair about it, but looking at the research, there's 3 studies. One of them showed that when somebody did the same foods twice blinded, only 33% of the time was it the same result. And what's more concerning is that when a poison was put on, the person, only 52% of the time it was picked up as being a poison. So, just another thing, I probably wouldn't waste my money doing it, but we all have our different, paths and journeys and what we want to try. The Cocoa Pulse test is an interesting one too. It's where you eat the food, someone checks your pulse, and they tell you based on your pulse changing, if you have a sensitivity to that food or not. It doesn't make a lot of sense when you know the science now of how food sensitivities can have a delayed reaction of a day to 2 days to 3 days. So how can you, notice a pulse change if you're not going to be getting symptoms for 2 to 3 days? So just kind of be cautious of some of these different ones. We'll talk more about how the mediator release testing is done and the science of it, but do you guys have any questions about this slide right now? Okay, so the mediator release test, basically what they do is they take 170 different vials and they put a different food antigen in each vial, and they put your white blood cells into those too. So they're measuring mediator release, again, those mediators right before causing symptoms. They're measuring mediator release from the cells based upon the change in volume of the cells. So if the cells get smaller, more mediators being released, and then they can kind of quantify that in a way using these bars. So the results look something like this. And this is just probably like 2/3 of one of 2 full pages of it, because again, 170 different things are checked. And it checks chemicals, which is a really great thing to have outside of just foods. So you can see here, for this person, green beans had little mediator release, up to mushrooms and spinach had high mediator release. So then what we would do with these results is we would say, all right, we're going to take the lowest green, and then I, as the dietitian, kind of cross-check a lot of these. Salicylic acid is high, making sure we're not having any foods that might have that in it. And then we end up with a list of about 25 to 30 foods that people eat for about 10 days or until they have 3 days of no symptoms or significant symptom improvement. And then we start to add foods to that, and it's a way to kind of figure out what foods are causing issue for people. So food sensitivity testing, a lot of options, some more science-based than others. If you want to kind of forgo the testing to start and just start with the food elimination, we can certainly do that. So how to start a food elimination? Have any of you guys done this yourself or helped a family member do this? Yeah? Was it fun? No.
I actually, mine was because I had an intolerance, not a sensitivity. And I really missed the food. I was intolerant to eggs.
Did you feel better afterwards?
Oh yeah, and I eliminated it from my diet for about 6 years. And I just started adding it back in.
Oh, good. Good. Yeah, it can be really hard at first, I find, but what I usually notice with people is if they can start to feel better, it gets a lot easier. And what I like to help guide people is I just want people to know, what's causing symptoms, what's affecting them, how it's affecting them. And then if people have that knowledge, they can kind of make the decision as far as what they want to do with that knowledge. So how to go about a food elimination. Typically, we'll eliminate the food for 3 weeks. Why 3 weeks? What's the magic of that? Well, for food sensitivities, if we are sensitive to wheat, say, and that triggers our immune system, it can actually take 3 months before that immune reaction totally goes away. So quite a long time, but that's a long time to do an elimination. So we'll notice difference in about 3-4 weeks, and that's why we say about 3 or 4 weeks of cutting it out, because then when you add it back, we should notice if, you're having issues with that. So then at 3 weeks, we'll add back one food every 3 days. Why 3 days? Because, again, if we eat a food today and we have a sensitivity to it, some people do have that delayed reaction, so we want to make sure we don't miss that. If you add the food back in, you have a reaction the day of, then just cut it out again. Once your symptoms go away again, add back the next food. And then document symptoms. I think that's really important, and I think I have it coming up. But sometimes we can forget when there's a lot of things changing, so documenting can be helpful to go back and analyze. That to make sense, we just want to kind of give this analogy. So you can think of our bodies as a softball, and before eliminating it, if we have a lot of sensitivities, we can be waterlogged. And if we eat that food that's causing us sensitivity, if you think of that as like a raindrop, we're already waterlogged, it's not going to feel a raindrop on a waterlogged softball. So if we cut out those food sensitivities for 3 weeks, the softball, our body dries up in a sense. And then when we eat that food, that rain, that wheat, we're going to be able to notice that rain on a dry softball. Maybe that confused you, maybe it made sense to you. Everybody learns differently, so this can be helpful. So the food elimination, we do it for 3 weeks. If symptoms improve or resolve, we start the re-challenge. If symptoms come back, we just cut the food out again, and then we challenge something else. If symptoms resolve, then we keep the food in, we challenge something new. If after 3 weeks symptoms persist, no change, we either modify the restrictions, maybe do some food sensitivity testing, that MRT testing, or think about other things that could be causing the symptoms outside of food sensitivities. And that's kind of where it's helpful to work with a provider like, me or somebody else who can look at your full intake and try to kind of connect dots between your different symptoms, your medical history, and all of that. So what to expect? Well, when we cut out our food sensitivities, you can expect some increased urine, and you might even lose some weight because sensitivities and inflammation can hold on to fluid in our body. So you might feel, just less puffy. 25% experience withdrawal within a few days. It usually lasts 1 to 3 days. You can feel a little bit worse before feeling better. If you're cutting out things like caffeine, or if you have migraines and that's why you're doing this, which mediator release testing is great for migraines, but then we want to be careful. We want to do it much slower so that we don't trigger, bad withdrawal symptoms. And so this is the same one that I showed you earlier with the different food changes that seem to help, per parent's report. So when we go through the sample elimination here, I did use just gluten and casein-free because of this, but there's all sorts of different eliminations that you can do, and it really just depends upon what symptoms somebody's having. So if you're confused about it, I would recommend connecting with somebody like me where we can have a better idea of where to start. But for autism, usually starting with a gluten casein-free is a really good spot, unless there's a lot of, gas, bloating, gut issues, and we might want to add something a little more to it. So getting started, I have a lot of slides kind of coming up of different food recommendations and brands and things like that. We have about 5-10 minutes left, so I might breeze through some of that. But again, this is recorded, and I'll send you the slides after. So foods to include, I like to focus on that because sometimes with our diets, we do have a lot of this dairy and gluten meat in it, so it can be kind of intimidating, but it's good to remember that all vegetables are good, all fruits are good. If you go to the farmers markets, a lot of the foods there are going to be good. You can do sweet potatoes and with olive oil and some grass-fed beef or wild-caught fish, or, quality meat's always good. I put quality, and also good to know that sometimes with the more processed meats, like the sausages and things like that, you can still get good quality, but they might be adding some dairy to it, so just reading ingredient labels. And olive oil, avocado oil, coconut milk, a lot of these really great nutrition-dense foods to include. And then with removing, people ask me, are eggs dairy? Eggs are not dairy. They're a common food sensitivity allergen, but they're not dairy. You can add soy if you want, like in that research study that we found to show improvement with the soy, casein, and gluten elimination. Gluten is found in rye, barley, wheat, and some oats. Oats is an issue of cross-contamination, so you can get gluten-free oats. But you just have to find the gluten-free ones, because the non-gluten-free ones have gluten in them from cross-contamination. For dairy, you're going to want to remove all dairy, cow, ghee, sheep, goat, at least for the elimination. And then if you want to try adding back a ghee or there's A1, A2 proteins in dairy, and we won't get into that today, but some people might be able to tolerate goat's milk because of that, because it's a different type of protein in it. Or they might be able to tolerate ghee after they go through the elimination. Ghee, it's clarified butter. So it's just butter with even less of that protein in it. It's used a lot in Indian cooking, but even butter sometimes people can tolerate just because it's such high dairy fat with very little of that protein that is that casein that can trigger. But the elimination would be more conservative. This is just what we talked about. How to start planning ahead, creating a shopping grocery list. Meal planning can be really helpful for people. And some people just prefer to go shopping and buying a lot of food options that would be gluten, dairy free, having that all in the fridge, and then they just don't have anything else in the house, which makes it easier, and they just plan that to eat out. Everybody kind of works a little bit differently. This is a symptom questionnaire that I was telling you guys about. It's cut off, so it's a little bit longer, but basically it's these different categories, and you're going to mark if you never get it, rarely but not severe, up to frequently affects severe. So you do this before the elimination, or we'll do this before mediator release testing, and then on day 8 we'll do it again. Day 16 we'll do it again, and then eventually we'll do it once a month. And I think it's great for everybody to kind of see the progress that somebody is making, because it can be easy to think, 1 month in, I'm still having this symptom, this is a huge bummer, but we forget about how much the other symptoms have improved because we just then focus on the symptoms that are left. So having this can be a good reminder for us. Just some resources, recipes. Pinterest is great. There's some nice cookbooks out there now that this is more popular. Some quality meat. I just actually had my intern create a really nice PDF of local farms, local quality farms. If you guys want access to that, just shoot me an email. There's some great dairy substitutes. You don't have to use, wheat and dairy substitutes. You can eat a lot of just natural wheat and dairy-free foods, but it can be easier during that transition, definitely. This forager yogurt is really good from cashew milk. And so cutting out dairy, what about calcium? It's certainly a concern, especially for growing kids, but you'll see that there are foods that have high calcium amounts, but you have to be eating really nutrient-dense foods instead of a lot of those just alternative gluten-free breads and things, trying to have some sardines in there, getting some tofu, if you're having soy and some of these other ones. There's an app called Cranometer where you can type in all your food for a week, and it'll actually add up the vitamin and mineral amounts in your total week. So then that can give you a sense as to if somebody's meeting their calcium needs. For adults, we usually need about 1,200 milligrams. Depending upon the age of the kid, it'll be a little different. And then just some more resources, grocery stores, meal delivery, wheat substitutes, bars, being planful and having snacks, nuts to munch on can be really helpful. So if you are on the go and get hungry, you're not, trying to figure out where to eat. And it depending upon where you live, it can be hard to find some dairy, wheat-free options. Here's just some meal and snack ideas. And then this is just a sample food journal of somebody that I was working with. She was having some autoimmune issues, so her 8-year-old totally switched over her eating, and I just thought they did an awesome job. This was after just one appointment, so just some inspiration for you as to what this might look like. I want to point on how the gluten-free, casein-free diet, it does have some risk to it. With gluten exclusion, we can be at risk for getting vitamin B deficiencies, iron, fiber deficiencies. Casein, risk for calcium, vitamin D, protein deficiencies. So we don't have to be at risk for this. It's just kind of knowing how to recreate the eating in a way that we're still going to be getting those nutrients. And doing nutrient testing can be really helpful for that too, just to make sure that it's not happening. Because again, we talked about this wheel. And then if you're feeling kind of overwhelmed, you can maybe start with, there's some interesting documentaries out there that can be inspiring. I really like this cooked one. And if you're not really into cooking, it can be a way to maybe inspire you to want to start cooking a bit. The Magic Pill, have you guys seen that one yet? That actually follows a girl with autism who works with a nutritionist, I think a dietitian nutritionist, and they change to dairy and gluten-free, and you can just kind of see her journey going through that. And then in summary, just eliminating food sensitivities can quickly reduce inflammation and improve symptoms. And then after the elimination, consider digging into why. If someone has a lot of food sensitivities, okay, why is that? Is there something more going on in the gut that we can do to support? Should we look into that stomach acid? Is there a yeast or bacteria overgrowth issue causing some of these? Is it just a lot of nutrient deficiencies preventing the body from healing properly? So a lot of different things that could be playing a role. So just some references. They're the PubMed ideas, so you just type those into PubMed. And I want to thank you guys. This is Holland Biomedical Clinic. It's a pediatric clinic in Minnetonka. I do contract work with them, and it's a new functional medicine clinic. We just opened last year, and we do a lot of the specialty functional nutrition testing. So if that interests you at all, I would encourage you just to go to our website and check it out a bit more. So we have 0 minutes for questions. Sorry guys, but you can ask me after. I don't think the next one starts for another 30 minutes. So thank you. Thanks for coming.
Thank you. And you're going to be emailing the presentation
Yeah.
also?
Did you put your email on there?
Yes.
Okay. Maybe as long as your handwriting is legible,
It
I will
is.
get. Okay, perfect.